Today, Great.com talks with Stephanie Paul, who is Executive Director at myFace. If you haven't heard of them, they are a non-profit organisation dedicated to changing the faces and transforming the lives of children and adults with facial differences. If you are new here, please press subscribe on YouTube or in your podcast app, because today we learn the importance of supporting those with facial differences. Hello, Stephanie, and welcome to our podcast.
Hi, Ryan. It's so nice to see you. Thank you for having me on.
Oh, it's an absolute pleasure. And yeah, today, Stephanie, I really look forward to this conversation. It seems like it's going to be super, super important. And yeah, there's a lot that I'd like to say extract from you to get to know about your organisation. So, Stephanie, to start with, for me and anybody new here, what is myFace and what do you do?
myFace is a nonprofit. We're based in New York City, but we serve the entire United States. And we're here to support individuals and families who are impacted by a craniofacial difference. And I think a lot of people would then say, well, what is a craniofacial difference? So it's any difference that would affect the facial structure, the skull, and it's something that impacts children as well as adults, in that children can be born with a facial difference, but there are also more than 100,000 people each year in the United States who are impacted by a facial difference due to disease or accident. And so that's a piece that I think a lot of times people are not aware of. And I think when people hear craniofacial difference, they typically will think of cleft lip and palate, which is, of course, the most common condition that people would have. 1 in 700 children are born each year in the United States with a cleft lip and or palate. But there are many other syndromes that affect people with craniofacial differences. And there's so many different levels to it. It's not just what your face looks like. It could affect your hearing, your breathing, your speech. There are many psychosocial elements related to a craniofacial difference. So we like to say that the work that we do is beyond the surgery. While the surgery is vitally important, it's all of the elements that happen after the surgery.
Yeah, Stephanie, thank you for sharing that with us. Because you mentioned there, like, some say individuals could be born with a facial difference, but also due to various reasons, it could be, say, disease or accidents. The individuals could actually have a facial difference there as well. So could you maybe tell us about some of those, say, people, the reasons why, like, they have a facial difference not from birth, other than, say, from birth?
Yep. Sure. I think one of the most common would be some kind of cancer, some form of cancer, jaw cancer, sinus cancer, where bone or some portion of the face would need to be removed in order to remove the cancer. And then it's how do you replace whatever has been removed structurally. And then in terms of accident, I mean, that can come in the form of, we've had many of our individuals who are part of our community who have been in terrible car accidents where they might lose a portion of their face and it has to be reconstructed. That can also, again, impact breathing, sight, hearing. So there's many, many different things that can happen. And it can be devastating for people because, one of the challenges we find is that the first thing you notice when you see somebody is their face. And if it looks different and you're not sure why, people often don't know how to react. And so one of the things we work to do is to educate everyone on how to interact with somebody with a facial difference, including perhaps medical professionals, because oftentimes if somebody comes in and looks significantly different, they may make an assumption that there is some intellectual inferiority, which is probably not the case. So it's really being thoughtful and mindful about when you see somebody who looks different, how do you react to that?
Yeah, I feel like that's super important what you just mentioned there, because when we meet somebody, the first thing is that we look at is their face. Like, we don't look at their body or their feet or anything like that. We always look at the person's face. And somebody with, say, a facial difference, it's not like they could hide it really. So I'm sure, like for that individual, there must be so many, say, things that they're actually worried about themselves, like maybe mental health issues as well that come up, especially if they're worrying about what other people are thinking whilst looking at them. But then you
Yeah.
also mentioned there, I believe, was about, say, educating people also about, say, some of the effects that happen to these individuals that could either be born with it or, say, go through some sort of incident. So could you tell us a little bit more about that at all?
Well, the way that we educate people, I mean, we have a lot of different programs that we started, especially in the midst of COVID. It really opened, I think, for many nonprofits, while it was very challenging, I think it opened the door for the ability to virtually deliver programs. But one of the really special programs that we have is called the Wonder Project. And the book Wonder was written by R.J. Palacio. It came out 10 years ago. It's about a young boy who was born with a craniofacial difference. It's Treacher-Collins is the syndrome that the young boy has. This is a fiction book, and he's homeschooled. And then in the 5th grade, he goes to school, and it's about his experience in the 5th grade and what that's like for him and how he copes. And that book has also been made into a movie several years ago, starring Owen Wilson, Jacob Tremblay, and Julia Roberts. So it's a very well-known book around the world, frankly. And so what we have done is we've built a school curriculum that we offer to 4th and 5th graders and other ages as well, but mainly to 4th and 5th graders, because that's typically when children are reading the book. And we do a virtual assembly where Dina Zuckerberg, who is our director of family programs, and she lives with a craniofacial difference, talks to the schools about differences, talks to them about Augie, who's the main character in the book, and about how to be kind and how to be an upstander instead of a bystander when you see someone being bullied or picked on or not treated in the appropriate way. So that's a really important program that we've taken from only doing in person, now virtually. We've partnered with Random House Children's Books, who's the publisher of the book, to really deliver this program across the nation. We've reached so many schools and so many children, and it's a wonderful way for us to share the story of Augie and why it's so important to be kind to one another. So that's just one of the ways we're educating beyond the craniofacial community about how to be kind. And it's so important right now, especially as kids are really getting back into school and they've been isolated for a while, and remembering how do you interact, how should you be socially. And so it's a really important piece for us to have that program out there.
Yeah, what you mentioned there, Stephanie, as well, was about just being kind, because we as individuals don't have a clue what's happened to that person, say, with a facial difference. Like, we don't know what they've been through in their life. They could have been through, say, tremendous pain. And I was just thinking about my own journey, because I guess I could have really described this as a facial difference. So I'm actually a traumatic brain injury survivor. And back in 2011, when I was attacked, I actually needed, say, an operation where I ended up with, I think, 30 odd, or maybe, I can't even remember, loads of stitches down my head. My left eye was pointing upwards. I had a tracheostomy, like the hole in my throat.
Oh, yeah.
And when I first saw myself for the first time, I actually, in my own head, I thought I looked like Frankenstein. And my eye obviously sorted itself out. But everywhere I went for a long period, people would just stare at me because I had these staples all the way down my head. And some people sort of were kind, but other people weren't so kind. And many people don't know what that individual has been through. So I think it's super important to be open-minded and to try and understand that person's journey and try and help them in any sort of way that, say, us as individuals possibly can. So what I wanted to ask you, Stephanie, now was, why would you say that what you guys do is so important?
It's really about bringing community together, and that's one of the things we've learned. So myFace has been in existence for 71 years, and up until a couple of years ago, very focused in New York City, Very have a wonderful relationship with one of our grantees at NYU Langone Health. We have supported the myFace Center for Craniofacial Care, which is an incredible team of comprehensive support. And that includes not only the surgical care, the dental care, but the clinical psychologist, a social worker, a nutritionist, a speech pathologist, really important elements, to help an individual as they go through their journey. But what we found is that there is a whole community in this country, and frankly, across the world, but we're trying to take it one chunk at a time, and do what we need to do to serve our folks in the United States. And we found that there aren't very many other organizations doing advocacy work in the craniofacial space. And one of the things I learned, so I joined myFace in January of 2020. So I had, the first 5 weeks of my tenure as executive director was quite normal and lovely. And then all of a sudden, we had a pandemic and we had to really pivot and think about, okay, what are we doing and how are we doing it? And really started reaching out virtually with virtual programming and, broadening our reach in social media, our web reach, and started meeting people. And, for example, one story I have is I met a young woman who lives out in LA. She's 27 years old, was diagnosed with cancer of her sinus when she was 13, has been through many, many, many surgeries. And at 27, got on a Zoom call with her and she said, I've never met anybody else like me. And to suddenly have the opportunity to be in a community, and now she's involved with us and she's meeting other people, she's helping other people. And just that, that one story to me is why we have to do what we're doing, because there are so many people out there who have been through so much. And when, you say the surgeries that you had, some of our kids and adults have been through 30 plus surgeries. We have a little boy who's 6 years old who's had, average of 2 surgeries a year. And these are major surgeries. And, you think about that and the trauma for that individual, the medical trauma. We have a podcast that we do. Again, Dina, who is our amazing spokesperson for our organization, has started a podcast where she talks about issues like medical trauma. Last week, she had a program where she talked with a group of young adults about that transition from being under the care of mom and dad or your guardian now to making decisions on your own as an adult. The week before that, or in February, I should say, she had a program about relationships and how do you, with a facial difference, have a relationship, and what are the challenges you face. So it's really vital, I think, because we want to make sure that we're there for the community, for those individuals who are living this journey, and make sure that they know that they are not alone in that journey.
Yeah, that's so important to have a community that, say, the individuals that are, say, have facial differences feel okay to, say, reach out, like it's safe to reach out to these communities, because I'm sure for many people it could feel a bit lonely, and like you mentioned there, feel like as if there's nobody to turn to or nobody to reach out for help and support. So I think a big part of it is community, like you mentioned, and I'm sure it could do wonders for, say, the individuals that are looking for that support too. So I'd like to ask you a question about, since its founding in 1951, what have been some of, say, myFace's greatest challenges, and how have you overcome them?
Well, I think the biggest challenge we have now has been what we're facing and have been facing for the last several years, and thinking about how do we expand our work. Delivery of medicine in the United States has changed, and what we were able to do 10 years ago is different than what you can do now. And I think for myFace, we're thinking beyond the surgical elements. Yes, we want to be able to make sure we're providing that piece and supporting that as much as we can, but thinking about the other, delivering the other important programs that, again, will help the community on a psychosocial level, if people are stressed out or these types of things, how are we delivering something that's going to be helpful to them? And then from there, it's making people aware that we exist and building, that support, a donor support, and finding those families out there who need our help. I think that's really a challenge in figuring out how do we really build the organization so that it can best serve the community we aim to serve. And so it's being as strategic as we can about what programs and services do we offer, what is going to be most beneficial to the community. And I think it's thinking through that and doing it in a very strategic and impactful way. Whenever we look at a program that we're about to develop, we have to think about, can we scale this? And how do we serve the most people? Or if not serving a large number of people and serving a small number of people is, what is the impact on that one individual family? Is that great enough that, balances trying to do a program that really will serve thousands of people or many, many people, like the Wonder Project, versus doing something like our support groups, which are more one-on-one direct services. And we do break our mission work down into 3 areas. We have grant support that we provide to institutions that we work with. And then we have the direct services, which would be our support groups. We have 2 apartments in New York City where families who are having craniofacial surgeries can come and stay in those apartments. We have a project that we're doing with another nonprofit called Welcome Baby, where we have developed these newborn craniofacial care kits, which basically have what a parent needs in the first 4 weeks of baby's life, including diapers and wipes and this type of thing, as well as appropriate bottles, so that they can feed their child. And we give these kits to hospitals around the country. So that's part of our direct services. And then there's the educational element, which I've talked about, which is our Wonder Project, our podcast series. We have a webinar series where it's much more sort of educational, less conversational, where we're delivering relevant topics that families can watch at any time, whenever they need the information, which is really terrific. Plus our website and all the things we're doing on social media to really get the word out there. So I mean that's how we're thinking about how do we deliver all of our programs so that we can serve as many people as possible.
Yeah, thank you again so much. What really stood out there was about how obviously you're there to support the individuals that have the facial difference, but also the family, the loved ones as well, because I'm sure it's very difficult for those too. So it's nice to hear that you offer the support not only for the individuals but for the families too. So I'd like to ask you then, what would you say are some of the biggest needs of the individuals that you support, and how are you a part of that solution?
Good question. The biggest need, I think it depends on where they are in their trajectory, right? So sometimes it's the need starts with people calling us up and saying, I don't even know where to go. And, how do you educate people about, picking a team, because you should be working with a team. So that's a really important element. The next piece, especially if you're talking about children, is navigating, going to school and what accommodations do they need? Especially, you said you had a trach. If there's a child with a trach or a feeding tube, they need additional support when they go to school. So helping to guide them in what it is they can ask for and how to advocate best for themselves. And then I think it's really that psychosocial piece, having that safe place where you can see somebody else who's like you or has been through an experience similar to yours, where you can talk openly about what it is you need, and help you feel confident and that, you can pretty much do anything you set your mind to, in spite of having a facial difference. So I think it's it depends on the level, where the person is in their journey. And we aim to really provide that support. And our support is not trying to replicate anything that already exists. It's trying to understand how much do the medical institutions do for the families, and where can we pick up where they leave off? Because a craniofacial difference doesn't get cured, if you will. You even if everything's been fixed and you presumably look normal, there's still issues. There's trauma. And so, what are we able to support at what point in the journey that person might be in, and making sure we're really thinking through all of those elements.
Yeah, you mentioned there about the person may say have their facial difference, say, fixed, as I say. I don't really like that word, but yeah, fixed.
Yeah.
But there's still, say, trauma that they've been through, especially like mental health trauma, because it must take a big toll on that individual, say, living with that for a certain amount of time, even though, say, they might have it sorted out. So yeah, again, that's just super, super important. So Stephanie, as we sort of wrap this up now, I'd like to ask you, what is your vision for the future?
My vision is that myFace is the national go-to organization for people with a craniofacial difference. You have a facial difference, you put in any of those words in Google, and we come up and we're here for you, and we're able to provide the support that you need. That's truly what I aim for, because we don't want anyone to feel alone. We don't want anyone to feel like they don't have the information. And we know that, when you go on Dr. Google, it's a bit of the wild, wild west. So you need to have a reliable source of information. And we're working to partner with other organizations, advocacy groups in the craniofacial space to make sure that we're really partnering and doing this together, because it's important. It's about the families and the individuals, in my view. It's not about my organization versus another organization. It's about how can we best serve this community. So that's truly what I hope to see in the future.
That's amazing. So if anybody's listening now and wants to get involved or help in any way, what can somebody do to help, and what action steps can they take to be a part of the solution?
Absolutely. Well, they can come to our website, which is myface.org. That's fairly simple, and take a look at the many things that we offer. We have a couple of programs coming up in our Transforming Lives webinar series. We've got a wonderful program happening on April 26th. It's a webinar where we're talking about, that transition from the individual's cares as a young person into adulthood from the medical perspective. So you can come to myface.org and look at the Transforming Lives webinar. Our next podcast, My Face, My Story podcast, is going to be on April 13, and we're actually going to be interviewing a lovely woman from the UK, Shelley Hull. And she's one of these folks who reached out to us, in her later years and said, I never met anybody. And I'm so excited to know about myFace. So that program will be on April 13th. We have an incredible program called myFace Celebrates. That's going to take place on May 2nd. That's it's our version of The Voice, where we have our kids with craniofacial differences who sing and perform, and they've been matched up with a mentor, and they're practicing now, and there'll be a live performance of their work. So we would love to have people join us for that. I think it's about coming to our website and learning about what we do, and understanding how best you want to get involved. And I think if nothing else, learn what a facial difference is. And if you meet somebody who has a facial difference, be kind to them, and make sure you don't say something mean. Say, hey, my name is Stephanie, and I'd like to understand a little bit more about you. And recognize they may not want to tell you at that moment, but it's about being kind. And if everybody did that, we'd be living in a very different world.
Stephanie, thank you so much for today. And for you listening, if you've enjoyed this episode, please press subscribe on YouTube or in your podcast app, because that will show the algorithm that this is an important conversation, so more people can learn the benefits of supporting the individuals and the families of those with facial differences.